Yes, welcome to this chat. The topic is when you have family history of cancer, how can you protect yourself? Let's talk about how you can treat yourself, you can protect yourself. How you can protect yourself and get to know the risk factors. Risk factors very important. So welcome everyone to the channel. Always I'm welcoming people every time. Every time I'm here, I have to welcome everyone. I have to welcome everyone who is watching and everyone who will come to the chat. Let's see. Yes, we are talking about protecting yourself from cancer. Protecting yourself from. There are some people in their families, they have factors of cancer. You find your grandmother or the mother or someone, it repeats itself because of the susceptibility, the risk factors. You remember when we were talking about breast cancers, we talked about breast cancer gene 1, breast cancer gene 2, and we saw human epithelial cells. And we want to talk about a short brief talking about how to protect yourself from cancer if it is in your family. It keeps on repeating in your family. Welcome everyone. Please tell me where you are watching me from. Come to the chat. Tell me where you are watching me from, and if you have not subscribed, please subscribe to the channel. Let's continue raising the subscription and letting people know that this channel talks about medical stuff, some good medical stuff that will help you, some good medical stuff that will help you to understand your body well and to avoid some complications that come with medical pathologies, some medical problems. So if you have not subscribed, subscribe to the channel. Come to the chat, tell me that you are watching me from the US, Asia, Africa. Maybe you are just next to me here and you are listening. Subscribe to this channel. Don't leave without giving me a like. And let's continue. If you are new, tell me I'm new to the channel. I'm watching you from this and this state. So welcome. I'm Dr. Ben of the channel, and let's continue to embrace talks concerning medicine, medical issues. We want to keep ourselves healthy. We want to keep ourselves out of hospitals without drugs. We want to keep ourselves out of cancers. We want to keep ourselves out of cancers. So you guys that are watching and you are new guy, come to the chat and tell me where you are watching me from. Don't just swap. You know, some people swap and then when it comes a time they realize, oh, I swapped a very important channel. You start searching. Subscribe, you'll get some notifications. Subscribe to the channel, you'll get some notification. And like the channel. Now, today we are talking about a very important topic. This topic is when you have these tendencies in your family of cancers, how can you avoid getting the cancer? How can you avoid getting the cancer? There are some risk factors that make a person to have the tendency of having the cancer, the tendency of having the cancer. So if in your family, you know, maybe you are having that tendency, how can you avoid? Because genetically you have had some people. Thanks for that like. If you're coming in, please hit the like button. That is Leila Ali, my sister here coming through. Welcome Leila. It's a very talk that I'm going to see. There are some families that the genetic line, you find that there are recurrence of cancers from this first generation, that great grandmother, the grandmother, the grandfather, great grandfather, the reoccurrence of the generational problems, you know. the risks of recurring problems. So how can you avoid these risks, and how can you avoid the cancer recurring to your family? There are some things that you can do. If you are a new person, please don't fail to subscribe. Come to the chat and tell us where you're watching from. Thanks, Leila, for coming in at this hour, 9:19. Let's talk about this recurrence of cancer. Everyone, new one who is dropping, subscribe and like. So let's continue. I'm going to take a shower and pray that I can stay with you well now. Oh, nice. Take a shower, my sister. Be fine. Now, if you have a family history of cancer, you can't change your genes. That is the first thing you need to know. But the significant you can significantly reduce the risk of getting the cancer. You see, there are some genes that people carry that are prone to cancers. Like, know your exact family risk. The first thing you should know is know your exact family risk. What is the risk factor in your family that makes you prone to certain types of cancers? Very important. Not all family history means that same thing. You see, not all family history means they have cancers. Now, who in your family had cancer? Your mother, your father, siblings, or grandparents. That is very important. Age, when it started. Was it early or late? Higher genetic risk. The late ones have higher genetic risk to the person that is next. This mean vlogs. Hello dog, good evening. Shift tonight. No, I have 1 hour and a half, then I go rest. I'm so tired, but I have to do this. At least welcome. Thanks for tuning in. We're talking about getting away from cancers if you have it in your family. Now, multiple relatives with cancers. In your family, do you have multiple relatives with cancers that have suffered cancers? It can be breast cancer, it can be esophageal cancer, it can be any type of cancer. But if you have multiple family members with same type of cancer, you have a higher risk. You understand that? So consider these things. It's very important. And if you have a question, my friends, don't fail to ask the question. And if you are watching me and you are a new person to the channel, hit the like button and subscribe to the channel too. There is some things that you can do when you have these problems. Consider genetic counseling and testing. Genetic counseling and testing means some cancers are linked to inherited changes, like gene changes, like you get breast cancer gene 1 and cancer gene 2. People get, when it has mutated, people get the risk of breast cancer and ovarian cancer risk. So there's some people in the family that carry the mutated gene. There is something called Lynch syndrome gene, which is the colon problem. Lynch syndrome gene, which is the colon problem. If you find yourself in your family line, you're continuously having the problem of colon cancers, a genetic counselor can assess your risk properly, recommend testing if needed, and guide early prevention steps. He can guide on how to do the breast cancer gene 1 and breast cancer gene 2. It is very important to do this. It is called genetic testing. So this one is when you have several people in your family that have gone through cancers. That's when you can test yourself. You can test yourself and see, now my family members have this. Then you go for the genetic counseling and testing. See, it's very important when you do these things in a good way. Now, start screening earlier than normal. If you have higher risk of screening may begin earlier or brand, breast cancer, you go and do genetic counseling and phenotyping, like you get to know if your breast cancer gene 1 or breast cancer gene 2 is mutated. Colonoscopy, you can do it at an early age, as 45 years. At 45 years, because as you get older, you get prone to problems concerning the stomach. You know, when immunity goes down, problems come. Cervical cancer, regular pap smears and HPV testing. Regular pap smear and PV testing. Because when you get it so early, you remember when you were doing cervical cancer, stage 0, you can manage it, you can handle it, and you get better. But when it comes to stage 3 and 4, it becomes a problem. The aim at stage 3 is not of treatment is not like the aim at stage 4, stage 2, or 0. Prostate cancer, you do a PSA testing, prostate antigen, specific antigen test. Testing in some cases to know if you have it so that you can start managing. The other thing that is very important when it comes to these problems, when it comes to cancer, is reducing lifestyle risks. Reducing lifestyle risk. Even if cancer runs in your family, lifestyle still matters a lot because it enhances you from getting mutations of your cells, like smoking that enhances free radicals to your body, causing mutations at your cellular level. Avoid smoking and secondhand smoking. Move away from people that are smoking. So if you think you are going to a club or a nightclub and everyone is smoking shishas and cigarettes and you are there and you are feeling nice, you are too smoking, and your family, maybe there is a risk of running, there is a risk of cancer. So when you continuously go to clubs and these things are going on, you are still smoking. Now limit alcohol so that you cannot get fatty liver. Weight management is very important. Regular exercise. Have your exercise. Always go to the gym, walk, do your job at home. If you listen to the topic that we had today and go through very slowly, you will understand what I'm saying. Eat more vegetables, fruits, and whole grains because these are something called antioxidants or Ontirese Ngobeni. My name is Zoe. Oh, Zoe, how are you? Welcome to the channel. We are talking about avoiding to get cancer. I know you are new to this channel. If you are new, subscribe to the channel. Tell us where you're watching from and like the video as we continue. This is a short presentation of how to avoid getting cancer. So welcome to the channel, Otri Nancy. Coffee Cakes, doctor. Hi. Hi, Coffee Cakes. It's a short session today of how to avoid specific cancers. Someone recommended we do this and I cannot bring that person down. So Ontirese is here, our new friend. He says her name is Zoe. Welcome. Tell us where, Auntie Zoe, tell us where you're watching from. Let's embrace you as our new friend. Reduce processed and heavy charred foods. Processed foods still bring something that is called free radicals. So let's avoid processed food. Eat more vegetables and whole grains. Antioxidants. Now, there is some things we do that can protect you by producing antibodies like the cancer cell. Some cancers are caused by infections, and these infections we can avoid them. You remember, like cervical cancer, it is the human papilloma virus (HPV) is highly anticipated, and it's highly suspected that it's causing. Most people that have it are the ones who get cervical cancer. So prevent cervical cancer, throat, and other cancers by HPV vaccine, hepatitis B vaccine, reduce liver cancer risk, hepatitis B vaccine. This is the way. Getting vaccines is a way to stay away from getting the cancers, because it protects you from getting the problem, these problems. Regular medical checkups, like if you have a family history of cancers, you have to have regular medical checkups. Monitor early signs of these problems. This is why we are sensitizing, and this is why I'm coming to you to sensitize you on how to stay away from this. Refer you early if needed. Refer if you get someone for medical practitioners. If you find that someone is having signs of a particular cancer, don't stay with this person. Refer them to the required, like an oncologist or like pathologist, to get proper treatment. Be alert but not anxious. There is some warning signs that you can get, and where this warning signs tell you that hey, there is a problem, you need to check yourself. Which ones? Unexplained weight loss. You just get unexplained weight loss from nowhere. You see, you can get when you have unexplained weight loss, you start thinking there is something wrong with you. Your lymph nodes, when you are having like tonsil nodes, axillary nodes, when they start having swellings, persistent, long-lasting cough or bleeding. Coughs are a sign of unusual bleeding, like the cervical bleeding are spotty. It is a sign of cancer. You see, it is a sign of cancer. So what we have talked about is very important. What I have talked about, high risk family pattern is very important. High risk family pattern. When you have high risk family pattern, seek help faster. You go to your physician, you go ask your physician questions faster. How can I prevent me from getting what the doctor suspects mutations, and then they will do some specific tests. You see, let's step 2, genetic counseling and testing. Testing if you have mutations is very important. Personalized screening. Screening is very important. Breast cancer, if family exists, you can do clinical breast exam 6 to 12 months. Mammogram early than general population. Breast MRI to check if there are some cells that have problems. Self-awareness, not just self-exam. You be aware of what can happen. When it comes to cervical cancer, do regular pap smears and HPV testings. Do regular pap smear and HPV testings. If high risk, short intervals, do pap smear within 3 months. If your family, you are prone to cervical cancer, do them within 3 months, so that when there is suspected, you take care of it very fast. Colon cancer. For those people that have colon cancer in their family, between the ages of 45, it starts between the ages of 45 normally. Take control. 10 years early is important. At 30 years, you have started doing some colonoscopy, checking your antigens test and checking your cancer cells if they are there, or some mutations. That is called genetic phenotyping. Your doctor will guide you on how to go through this. Prostate cancer, PSA, often at the age of 40 to 45, you start doing the PSA earlier. For men, general surveillance like full mammograms are very important. They help so much to guide you. Imagings like X-rays and MRIs, they help so much. Yeah? And then lifestyle, my friend. Even with genes, like without genes that can produce cancers, you should check your lifestyle. There are some people that their lifestyles are very complicated. Smoking, drinking, you end up getting lung cancers, bladder cancers, and cervical cancers, head and neck cancers. Hmm? Diet protection. We have talked about diet earlier today. You physical exercise, at least 150 a week. What about skin cancer? Skin cancer is the same. You know, there are some coffee cakes. There are some the mutation of a cell is a mutation of a cell. So how come cancer comes? It is the same way at any point. So when you are having the mutation of a cell in your skin, it is just like the mutation of a cell in your cervix, because it is mutating through the DNA inside the cell. So it produces cells that are not differentiated. By differentiation, I mean cells that are not doing the job that they are supposed to be doing. Like the skin cell is supposed to cover you and protect you. But when they are mutated, you start getting skin cancer. It means they are mutated from the DNA. So they are producing skin cells that are not skin cells. Even in the epithelial cells, in the mouth and in the vagina, the cervix, the same thing will happen. The process of differentiation is messed up because a mutated cell, any mutated cell cannot do, this cell of the skin is supposed to do its work as the cell of the skin. The cell of the cervix is supposed to do its work as the cell of the cervix. But when it mutates, it now gets out of this differentiation process, whereby the differentiation process means it is supposed to be doing what it is doing. You see, weight control is very important because more fats. Hope the coffee cakes you have understood, or I'm moving so fast. Yes, I'm moving so fast because today I don't have much time and I have to come and talk about prevention. Excess fats increase estrogen and inflammation. So, risk of cancer. People that have excess estrogen, no. That is a fibrous tissue. It's not a cancerous tissue. A scar tissue is not a cancer. That is a fibrous tissue. So don't worry if you have a scar, it cannot turn as cancerous. It cannot. No, it cannot. A scar tissue is a fibrous tissue. A healing process. It is called a healing process, so it cannot turn as cancerous. Excess fats tissue increase estrogen and inflammation. Women that have high estrogen level, they are prone to cancers. They are at risk. Even men that have high estrogen, they are at risk of cancers. Let's talk about alcohol limitation. I've always talked about alcohol. So let's just bring down the excessive intake of alcohol and smoking, because we don't want. Did you remember to double tap your screen? Oh, thanks, people. Coffee Cakes is saying you double tap your screen, we get more likes. Alcohol limitation. We don't want breast cancer, liver cancer, and esophageal cancers. We want people to be healthy. Now, 5 steps of vaccination, of preventing. This is the 5th step. HPV virus, cervical cancer, anal and throat cancers. Hepatitis B vaccine. Hepatitis B for liver cancer. Vaccination is important when it comes to cancer. So take a step when you are prone to these cancers. Step 6, Monitoring early signs. How do we monitor early signs? How do we monitor early signs? Betty is here. Welcome, Betty. We are talking about how to avoid cancers. How to avoid getting cancers even if it is in your family. Now, persistent lump, breast, neck growing, unexplained weight loss, chronic fatigue, you are just tired, blood in stool or urine, yes, persistent coughs, you are always having persistent coughs. Be careful because the coughs might be coming with something that is not good. Abnormal bleeding, mostly in vagina, and it's not menses. When it comes to, if you notice, menses don't clot, but when you are bleeding and you're receiving clots, start questioning, where is this blood coming from? Now, step 7, physical and long-term medical planning. Reduce anxiety and structural follow-up. Avoid unnecessary repeat scans. If you don't have, you don't have. Take it within 6 months or 1 year. Create a long-term surveillance. That is how you can avoid getting cancer, even if it is in your family. So, you guys, you're good. If you are watching and you have a question, you can ask right now. There is someone who told me to go through vision problems. Eye problems. Eye problems. What are eye problems? So anyone with a question who is watching, if you have a question, you can ask. I want to start eye problems and then I'll continue with it tomorrow, the same time as this. Yes. Visual problems and complications of the eye. For you, your vision not to see clearly or affect the health of your eyes. Blurred vision, double vision, difficulty in seeing, reduced peripheral visions, eye pain, red eyes, excessive tearing. Sometimes you feel flashes going through your eyes, sensitivity in the light, sudden loss of vision. All those sudden loss of vision is an emergency. Those are things that I'll talk about. So common eye disorders are like, I'll go through them because my time is going. Refractory errors, it is called myopia, short-sightedness, difficulty seeing distance objects. The other one is hypermetropia, long-sightedness, difficult seeing objects that are here, but you are seeing objects that are so far. Astigmatism, is distorted or blurred vision due to irregular corneal shape. We'll talk about it. If you have one of them, you tell us. Presbyopia, age-related difficulty focusing on object. You have seen some adults doing this, looking at things that very close and they are struggling. That is called presbyopia. There is something called cataracts. Cataracts are clouding of the lens caused by blurred vision or glare, common in adults. Mostly when you have some chronic problems like diabetes, treated with surgery. This one is surgical. Glaucoma, damage of the optic nerve may cause loss of vision. We will talk about glaucoma. Diabetic eye disease, it is called diabetic nephropathy. People with diabetes have eye problems, and you will see how it comes. So, age-related macular degeneration, age-related conjunctivitis, pink eyes. You have seen people with pink eyes. It is called conjunctivitis. All this we will go through it. Now, today my time is it's not much. I would like to thank everyone who has tuned in, and anyone with a question before I log off, a specific question that you think we can ask. Anyone who has a specific question, Let me give like 1-2 minutes to see if there is someone who has a question that can ask. Sometimes I don't like going without making a person satisfied. Maybe sometimes some person has something to ask and I'm very rushed. That person cannot be happy. So thanks for everyone who has watched. Be blessed, everyone, for what you for the short time. If you are coming in right now, you Stan's Kitchen. Good evening, Dr. Benjamin. Welcome, Stan's Kitchen. I'm just about to log off, and I think you will rewatch the topic. So everyone who is here, share and have your questions for next time, because my time is gone. Bye bye. See you tomorrow.